Welcome to Centered Presents The Future of Health. Join me, Christina Walecka, along with Dr. Molly Brown, as we dive deep into the world of brain-based wellness.
In each episode, we will explore cutting-edge insights and practical techniques that empower you to achieve optimal health and super high-energy living.
Tune in and start your journey toward a healthier, more vibrant you.
On today's episode, we will be discussing Bioregulation Therapy, and we have as our guests Dr. Gabor, who developed the therapy, Michael Holler, and Turul Sengel. We'll be discussing the benefits of the therapy, the unique aspect of the PMF bioregulation therapy, and some of the results we're seeing in our clinic. I've personally brought in the BRT therapy to my clinic recently, and in our brain-based approach, we're having accelerated results with autoimmune, mental health, metabolic, and chronic pain conditions. So we're really excited to have our guests here, and we'll be discussing what makes the BRT unique and how it accelerates results. Welcome here, Dr. Gabor. Can you please tell us a little bit about how the BRT therapy was developed, the philosophy behind it, and the communication transport method?
So BRT has a pretty long background. I started to work in this field in the 1980s, and so 40 years ago. And I was looking for a way to do something like in Qigong, to work directly with the energy flow, which help us basically to synchronize our activities. And I have understood that in modern biophysics, this field, what is called electromagnetic biocommunication, is already measured a lot of features about how to synchronize the different biological activities and what is beyond neurological communication. And then I decided to specialize into this field. And since the beginning of the 1990s, I also had a chance to carry out a lot of research and show that even on DNA level or cell membrane level, all the regulatory processes in the body are controlled by this field, what we call electromagnetic biocommunication. So we work those communication signals and we facilitate communication. In the US, a lot of research was carried out in the 1950s, 60s, 70s, and actually the first functional device, which also got FDA approval, was developed by Dr. Roberto Becker, who was an orthopedic surgeon. And in the 1970s, he was a true pioneer in this field.
What was his initial device?
His initial, well, actually, it was just a device. People called it a Becker box because his name was Dr. Roberto Becker, and it was facilitating communication signals for bone repair and scarring processes. And after 20 years of research, he achieved to support the healing process, even in cases of the so-called non-union fracture. Non-union fracture is when somehow the body doesn't find the way to reconnect the broken bone pieces. And some people have also major scarring difficulties. And he was the first could help those electric processes, which represent communication signals or signaling processes in the tissue, and improving these communication processes the bone healing and the scarring process goes well, even in very difficult cases.
Okay, yeah. So I've actually read that research. That was at the first PMF device.
Not really. I mean, PMF has a longer background, and PMF was already used in Europe quite extensively in the 1930s. So PMF has a longer history in Europe.
So with what you developed, it's a combination of postmagnetic and biofeedback, correct?
Yes, actually, this technology aims to help communication on tissue level. It is not about communication through our senses, so you don't hear or you don't see those signals. You don't need a cognitive pathway, so you don't have to think about, you don't have to be aware mentally about this process. So we can support what goes on in your cells, what goes on between your cells. So intra and intercellular communication we can support, and this is basically a direct help uh, for all the adaptation processes, because you have to synchronize all the different activities in the body. So the different, let's say, also biochemical but also other activities in the body, they don't happen randomly, they happen very highly synchronized, and here communication is key. So today, when we use right now, so you and me, we communicate through telecommunication devices. We created telecommunication devices for the tissues.
Yeah, out of some of the studies I've read, what I really love what you're doing is instead of overpowering our cellular communication, like your technology is using the body's natural communication to just improve it.
Absolutely. This is a very important point, and that makes this technology distinct from other electromagnetic therapy modalities, because here we don't impose any like force or any field or any electric signals to the body. Here, like today, the Wi-Fi signals carry my voice and my picture to you, and your voice and your pictures to me. So the electromagnetic signals function like a carrier wave. So we create carrier waves, and the natural signals of the body are available in the range of the applicators. So this is natural. This is focusing on the natural communication processes of the organism.
Amazing. What was your initial purpose for developing the technology?
Well, I have seen that we do it anyway as human beings. We interact with each other, and the presence of certain people might help you psychologically, might help you metabolically, can make you stronger, can make you, let's say, more skillful. And this is the biofield. So a human being has also an electromagnetic field, and the information content of this field can be very beneficial. So I started to practice um, what I call qigong. I started to practice at an early age as a child, and then I have seen, since my focus in my studies was mathematics and physics, I have seen that um, we can, with the modern technology, we can capture at least a part of this biological field, of this biofield, and we can use through the devices in a standardized way this supporting such electromagnetic signaling processes. And once the signaling process is more precise, then everything functions better in the body. So it is like the old qigong in a new setup, in a new version.
One of the most noticeable results when we're using it in my clinic is people feel lighter and happier. And I notice it, kids are so energetically like malleable, right? So I notice when I put my kids on the instantly, my kids like, because they have a lot to deal with at school these days. There's a lot of personalities, a lot of energy. But instantly my kids, they brighten up. They feel more relaxed and calm and they brighten up. And one of our top results that people say, like, they're like, wait, why do I feel so happy after a session? That's what I have already noticed, is that people have a stronger field after a therapy session. And they even emotionally feel better. So it's like, seems to synchronize the brain and body. Even we're seeing reflected data in the neurofeedback, in their neurofeedback sessions are accelerated with the BRT, which I find very impressive.
Yeah, we can basically combine this new technology. We can combine with any other therapy modality because we create better availability of your own signals. So when your own signals are like today, if we can speak without interference, without noise, we can see each other well. It is easier to communicate. So we create an environment where the natural communication signals are easily available for the body. And then all the different body parts know better what the others do so they can synchronize their activities. So you are like simply more coordinated, more coherent, and then obviously you become more performant. So everything what you do, like in sports, when your running style is better, you can run faster. When your circulatory activity is more synchronized, you can run faster. When your breathing is synchronized, you can run even faster. So we can synchronize, we can help in these synchronization processes. So the people become more performant. And then it feels like easy. So if you run easily, you don't feel stressed out because it is easy for you. So you just feel fine.
Yeah, I mean, I've definitely experienced that firsthand. There's input and output devices. So your own body is giving information to the session, which then is balances out what you need. So how did you actually develop that?
Well, actually, to be honest, the signals of the devices, they don't balance you. Once again, they make your own signals more available or less noisy or um, let's say like this, visible from different aspects. So we have different type of devices, and with the different type of devices, we can like facilitate in different way the availability of your own signals. It's like you become more visible if the camera is better, the resolution is higher. So we create an environment when you understand your own signals better, and automatically the regulation comes from the organism. This what we call self-regulation. So we have to first understand that the background of all this is the fact that we have a permanent self-regulatory activity. And this is important to understand, that we don't have to tell to the cells, do this, do that. They do it anyway. They know how to do it. But sometimes they have difficulties. They have difficulties because of accumulation of metabolic waste materials. You cannot eliminate all the metabolic waste materials, or you have difficulties because of any kind of low level, high level inflammatory processes, or you have an injury, or you have a, any other, like psychological distress. So you have all kind of ongoing processes which can interfere with the communication. And now when we like make available, specifically through the technology, it is easy to understand your own communication signals. um, you don't miss it. It's like you listen in a nice environment, your favorite music, and you don't have to listen in a construction site where you have all kind of noises. And although you listen to your favorite music, but in a construction site you simply don't hear it well because of the interference with other noises. And despite of inflammatory processes, infections, electrosmog, fatigue,
Psychological
distress,
stress.
psychological distress, we have the possibility to pick up your signals and make it available.
No, I think that's a really good point and super important. Again, like the body is an amazing thing and it can heal itself through your device. You are improving communication so that it accelerates it makes it easier, and it allows you to function the way you should be functioning when you remove all of the other stuff in life that gets in the way.
I think that's why we see such an accelerated result, because we do all nervous system and brain-based work. So it seems to calm the nervous system down very effectively immediately. And then our work even works better. It's like even before the brain-based work.
Yes, absolutely. So we have pre-session treatments, we have during any kind of other therapies or other activities, options, how to use the technology. So you have always certain communication channels in the focus of, depending on your activity. And if those communication channels function fine, without noise, without too much noise, then you accomplish whatever task you want to accomplish. You can accomplish that task much easier, really much easier. It's like you remember everything, you can write an essay easily. But if you have too many other thoughts in your mind, then it's difficult to focus on one thing. So we help that those communication channels are available for you, and it needs a shift of paradigm. Healing comes always from within. It never comes from outside. So maybe we can stop with a medication, an inflammatory process, or we can extirpate with an operation, like a gallbladder or anything which is in a high level inflammation. But the healing, what comes, to close the wound and to restore the physiological processes, comes always from the body. So it never comes from the surgeon. The surgeon can remove certain parts, but how to make it as one big unit, how to cooperate between the different body parts, this comes from inside, from within. It doesn't come from outside.
I think you're right. I think we do need a paradigm shift of what is health, right? Like what is health and what is healing? And to even get to any type of healthy state, you have to have a sense of coherence and nervous system regulation to begin with. And then the body can heal, and then your like inner vitality is restored. That is honestly like the paradigm shift that needs to happen of the definition of a healthy person, right? Like there's a radiance and a vitality to that person.
Yes, yes. And think about that. You get tired, you sleep, and then you feel strong again. While sleeping, you didn't eat anything, you didn't change much, you even used up a part of your energy while sleeping, but still you reorganized everything. So it's about entropy and negentropy. So basically, you get disorganized during the daily activities, and once you rest or meditate or you sleep, you reorganize everything, you realign everything, so you are strong again.
And you did such a good job of with the technology and the way it's set up. You can really focus on specific protocols like digestion, energy, hormone level balancing. I think that's something people should be aware of. Is there options to really focus in on one thing that you may be struggling with?
Absolutely. So I really suggest to most of the people to use the technology while eating and right after eating, after a meal time, because it will help to synchronize all the different activities of the digestive process.
Oh, interesting. Wait, I have to tell you, my favorite word is negentropy.
Yeah, we help to produce negentropy. That's scientifically, that's the formulation. That's how you call it.
Yeah.
But you can ask Michael. I mean, he is using in his work for 2 years now, and then he has a lot of experience. So maybe he can help us out with some of those clinical experiences.
Michael, we'd love to hear some of your specific results and experiences using the BRT technology.
Really quickly, can we explain to the audience what a BRT session looks like so that they understand what we're referring to?
So, the first thing I'm using two devices in my typical session. The first thing I do is I start the Nesta mobile unit for about 5 minutes. Usually, I do either anxiety or quiet body or metabolic. And I got a timer I set for 5 minutes. Then if I'm going to use the Cellcom, which is the larger unit that I would use in the office, then that would be started 5 minutes later, and I'm going to do whatever protocol I'm going to do with them. That's typically 30 to 60 minutes, roughly. As you pointed out, people feel calmer. One of the things that I do that I find really helpful, because the first question they ask is it shock therapy? And of course, it's not. Nobody's being shocked, no signals going in it. But what happens though is I will ask them whatever they're dealing with. Is it anxiety? Is it trauma? Is it pain? And I have them put it on the typical scale, 0 to 10, with 10 being the worst and 0 being the best. And within 5 minutes, I'll check in with them and say, so what is your number? And I find this also psychologically reinforcing or behaviorally reinforcing, because if they come in and they're really anxious and their number is 8, let's say, 5 minutes later, I say, what is your number? They say 6. And I'm like, well, good. That's a 25% improvement. And that's reinforcing to their brain, because they're saying, does it give me a readout? Does it give me an x-ray? No, it doesn't do any of those things. But what we're doing is we're asking them for their feedback. And they can't argue with their own feedback. And then I can jump in and reinforce it with the math. And usually by the end of the session, it's down to 2 or 0.
What kind of cases are you constantly seeing in your clinic?
So trauma, anxiety, depression, sometimes physical things that they're trying to deal with. For example, there's a really excellent program under gynecology for women who are having PMS problems. They come in and they're in premenstrual, or they're during their menstrual period, and they're crampy and they're grumpy and they're uncomfortable. And 20 minutes later, all of those symptoms are gone. And that's one I can say that in my experience, there's never been a single woman that I put on that it didn't work.
Amazing. So you're seeing great results.
I mean, and other things too, because, for example, my wife has autoimmune disorder. She has vitiligo, for example. And after about a year of that, she's Sicilian, so the white blotches on her olive skin really show up. And I can show you the photographs. Her improvement was astronomical. Just last week, she went to see her gynecologist for her 1-year exam, and she's 67 years old. And he came out after the bone scan and said, "What have you been doing?" And she said, "What do you mean?" And she thought she was alarmed. And he said, "Your bone density increased 20% this year."
Oh my gosh.
He said, "I've never heard of that before." So, and I know she uses her Nesta unit about 4 to 6 times a day.
It's a series of protocols, and then I believe what we have to understand that there is always a reason why the body cannot continue doing fine something. So there is something interfering with the normal activity. So we have to eliminate a lot of food type of intoxications or other lifestyle issues. And once the body doesn't get bombarded with different unnatural, triggers, then step by step, in the normal rate, you can rebuild your tissues. So we have to understand that once we meet in a year, there is no one single atom which is the same in you or in me. So you are reconstructing your body all the time, and it has a reason why you are not successful and why there are tiny mistakes and more tiny mistakes. So if you eliminate those triggers which cause unnecessary interference, you have a better chance to reconstruct your tissues in a normal way. And then simply aging is very different. Aging is very different. You don't have to lose all your body functions and all your capabilities. So we can help many people to restart producing hormones like normal, restart producing, liver enzymes like normal. So, so once again, if you follow the protocol and you change your diet, you do some exercise, and certainly you rest enough. You need your daily sleep and daily recovery, negentropy. You need, and then you have a chance to rebuild your tissues. So this is not just about the device. It is more helping natural rhythm in the body. We have natural rhythms. We cannot always go against natural rhythms. So we have to follow nature, and and I believe this is the most important result of the research what we did, and my groups did a lot of very detailed research, and other friends groups did other research, and to summarize the outcome, we have to respect nature. That's it. So simple. Once we go with the flow, we go with the natural rhythms, everything just normalizes in the body.
Well, that's why I think we love your product, because we do the brain-based wellness work, which you mentioned, like triggers and things that like are holding us back. And you mentioned a lot of food and nourishment and health, but we use the brain-based wellness work to clear those triggers and reset the nervous system and create new neural pathways so people can move on from the stress and trauma that's really been holding them back and interfering them from like moving forward. And then with your device, like it totally just accelerates those results.
Yes, and for that purpose, we created a software package, which maybe Toro can show because he created a few slides, and this software package is addressing exactly this, what we are talking about. So this is, I believe, a very useful software package for basically everyone today. In our modern world, we all need this type of support.
The product you guys just developed for daily use is really needed. We need to restore daily. And that's where some of the wellness world is talking about like biohacking, right? I don't really like that term because it's kind of it's even going against what your body can actually do. Whereas that's what we need to look at is restoring the body's processes so that we can restore the natural order and be connected to the intelligence in nature in the world in general and let that heal ourselves.
Yeah, your body knows what to do. It just needs to get back to the roots and be freed to be able to do it.
Self-healing, yeah.
Self-healing. Turul, do you want to show us?
So this basically talks about the different types of programs available in the Nesta Meta Balance device. These are programs that can be used daily. They have two duration options, 30 minutes and 55 minutes. And that allows the user to balance theirs and support their body day on a daily basis.
Yeah, so we have one night program which helps to, let's say, be peaceful during the night and helps lymphatic system to eliminate all metabolic waste materials. And then uh, during the day, everyone can use like emotional balance or lymphatic support or detox support, because it's very important nowadays that we can eliminate all the metabolic waste products. So metabolic activity produces a lot of waste products, and we simply cannot accumulate more and more and more by the years, because then it will interfere with a lot of normal activity, metabolic activity, and this is a key, or digesting your food and getting uh, all the nutrients what you eat for, because that's the reason you eat. And then it is important that people don't have intestinal flora and other issues. So these programs are basically for daily maintenance, and also it has naturally a very strong and anti-aging effect. And then many people feel in the nervous system aging, and then you cannot coordinate your movement as well as before, and or you basically um, don't see as well, don't hear as well as before, and then sometimes mental performance is declining, and then it is again something very important to support. So with this program package from joint bone support up to mental performance optimization, you have basically everything. I do work with a lot with Olympic champions, and in sport medicine we work a lot, and we can really help people uh, to normalize stress levels and optimize coordination and focus, and also the night rest, because they have to recover after heavy competition, because next day is the next competition, or even between competitions, when one day you have 5 6 different heats, and then you have to recover between the heats and perform better and better, because when you make it to the next heat, it means that you have to perform even better than.
I feel like the athletes they're always looking for that edge, right? So that makes
Yeah.
perfect sense that if to support on a daily basis
Yes.
for an athlete.
So, but today many people live like an athlete, because the daily life is sometimes really hard to say, exhausting. So people don't perform in the sport world, but they perform in the professional world with the family members. So this is pretty much the same.
Exactly. Yeah. And this is so great to see daily support programs because our food sources are so much weaker than they used to be. And the body's just they don't have as much support. But you're saying like this is just as daily support for the entire field can make your whole organism stronger.
Yeah, yeah. You are more coherent. You are more organized, more aligned. So you withstand all the pressure better.
Amazing. Yeah. Who wouldn't want that?
Yeah. Well, because I feel like so many times people just try and take more supplements or they try and, take something internally, but we're talking about the whole sort of the whole biofield, the whole electromagnetic field.
Yeah, and about the level of being organized. So it's very important, because you can buy the best running shoes, um, you can eat the best food. If you are scattered, you are mentally not organized, if the circulatory activity, if the breathing is not organized, you don't perform very well.
Yeah. So for the types of people that have the chronic and complicated conditions where they just don't seem to make any normal progress that right that's like the type of people I work with because they've just gone to so many people and they're really deeply looking for more of a like, after Western medical hasn't worked and after supplements haven't worked and after IVs haven't worked. They're looking for more profound systems because we're so dysregulated nowadays. Is it always been this way, or do you think it's the EMFs, or is there because we have such increased toxicity in the United States?
Well, everywhere, like modern agriculture changed everything. The seeds are hybrid, and the soil is like depleted, and the fertilizers are simply not enough, and people lack all the trace elements, because of the depleted soil, and then for the large scale production, people use a lot of agrochemicals, and then the food industry processes the food and uses a lot of additional, chemicals, which makes assimilation of the nutrients even worse, even more difficult for the body. So then people eat in a very in a rush, so in a very abnormal way, on the way, and they simply don't have the neurological conditions for good digestion.
No, not at all. Not in America.
So then they drink icy drinks while eating. So you do everything to make it more difficult. No, modern lifestyle makes everything to make it difficult. And then usually people eat 10 minutes before going to sleep. So once again, it is even more difficult because your night rest will not be complete because you are still busy with other things. So a lifestyle is really not ideal for a good metabolic activity. And then we have to change it back to normal and eat not that late and eat in a quiet, joyful environment. Feel the taste of the food and not the taste enhancers, because people are used to, like, addicted basically to different additives, and they look for the taste enhancer and they don't look for, let's say, strawberry. They want the strawberry like taste, and if it's real strawberry then they don't like it. So there are many studies with children, they don't go for strawberry, they go for the standardized strawberry like taste. And then your body gets basically one difficulty after the other one, and struggles all day long. And then it's still a wonder that the body can do it, because if someone comes from a place where they still eat normal, and there are different studies, and they eat only 1 month uh, big city food, completely processed food, they become very ill because they are not used to. So in the city, the children are used to that, so they tolerate better. But if someone comes like 30, 40, 50 years old, first time to the big city, and after 1 month becomes ill. So we have to understand that. Uh, okay, we are used to that because we daily, reinforce ourselves to do that, but it is not good for us.
Right. With the BRT therapy, we're actually working to restore coherence and sort of our innate intelligence, even in our daily lifestyle and food choices, because there's not like, we can't keep I mean, almost everyone I know is as busy as they can get, right? So it's not that we want to you know, take things so that we can do more. You're actually saying that we actually want to have a little bit more innate intelligence so we can calm things down and maybe do less and let our body function better so that we are healthier in the end and can be more creative and accomplish more.
Yeah, exactly, because you will accomplish more. So it seems like at the beginning you do less, but at the end you see you accomplish more.
A huge opportunity right now for this type of work and to create, a much more sustainable level of health for everybody.
Well, you guys, this has been so amazing. And if you wouldn't mind, Turl, wrapping us up by kind of sharing where your products are available, what's new, and your resources.
Yeah, let me talk about that a little bit. I think the key thing is BRT is really positioned in the intersection of self-care and cutting edge technology, right? We were talking about future of health. And when you look at the market and what people have been doing the last 5, 6 years, there's a tremendous demand and shift to figure out what works for each individual, and they're not all the same. And they're realizing that they need to do something much beyond the standard care that's been provided by the health care system in this country. So everybody's looking for something more and something specific and something unique that they can do. And BRT fits into that really well because it allows them to have something that they can customize and use at home, and also have a support from a clinician if they need to. And most cases, that's where they start, and they will end up having something at home to be able to kind of continue with their journey. Now, with BRT in the US, the Nesta is the brand we've been talking about for home use. And we talked about one product called the Nesta Meta Balance, really about general health. We talked about a few of the programs a few minutes earlier. Our website in the US is bioreg.us. That's where people can go and look for some more information. But the key thing here is that individuals, clinicians who are doing unique work, looking beyond the standard care, really drive this kind of awareness. This podcast is one of them, absolutely, because that really allows people to understand there are different options that they can work with that will help them immediately, not 6 months, a year, 3 years in the future. Right now, they can get support from different technologies, and BRTs is a key technology available to them.
Well, again, we are so excited. We love everything you're working on. We've had accelerated results, and we're so grateful that you guys took the time to be here and share more and share all of your insights. Yeah, it's incredibly useful and insightful information. So thank you so, so, so much.
Thank you for having us.
Thank you for having us. Yeah.
Thank you for joining us on today's episode of Centered Presents The Future of Health. If you're interested in learning more, please visit us at drmollybrown.com or email us at media@drmollybrown.com.